Which of the following infections would require that the patient is isolated? The options are A. Hepatitis B, B. Clostridium difficile, C. AIDS, D. Legionella. Answer is B. Clostridium difficile. Clostridium difficile is an organism that is known to be transmissible in clinical settings as it is able to contaminate the environment. It is therefore important that the risk of transmission to other patients is minimized by nursing symptomatic patients in SOS isolation. Which of the following items are not routinely required when isolating a patient? The options are A. Disposable non-sterile aprons, B. Sterile latex gloves, C. Non-sterile latex or nitrile gloves, D. Dissolvable laundry bags. Correct answer is option B. Sterile latex gloves. Sterile gloves are not normally required for routine SOS isolation unless the patient requires an aseptic procedure to be carried out. All the other items listed will be required to protect the staff and reduce the risk of organism transmission. What are the symptoms of a wound colonized with MRSA? The options are A. Inflammation, B. Pain, C. Pyrexia, D. None of the above. Correct answer. Option D. None of the above. Colonization means that an organism is present at a site but is causing no harm, unlike when infection is evident. Therefore, a patient with a colonized wound will have no symptoms related to the organism in the wound. Which one of the following statements is correct? Standard precautions should be implemented. The options are A. When the patient is known to have an infection, B. When caring for any patient at any time, C. When caring for any patient in a hospital, D. When the patient is being nursed in isolation. Correct answer is option B. When caring for any patient at any time. Standard precautions should be used on all patients at all times to reduce the risk of organism transmission to healthcare workers caring for them. They have been designed to be practical and easy to carry out and reduce the risk of blood-borne organism transmission significantly. An aseptic technique should be used when carrying out which of the following procedures? The options are A. Carrying out mouth care, B. Changing a dressing or an intravenous line, C. Emptying a urinary catheter bag, D. Insertion of a suppository. Correct answer is option B. Changing a dressing or an intravenous line. An aseptic technique is required when there is a risk of transmission of pathogenic organisms into a vulnerable part of the body. So, when carrying out a procedure that risks organisms entering the bloodstream, an aseptic technique should be used.